Hi everyone, this is Dan from DA Who Mechanics. How are you doing? So we're in the clinic today again. I've got my bobble hat on, 3 layers, got some gloves on because Baltic, the boiler's broken. But let's crack on. This is second time lucky for me. My computer crashed yesterday. That was an hour and a half down the drain. I was devastated. So, welcome to section 5, this pre-recorded video on the muscular system. Well done so far, by the way, on sections 1, 2, 3, 4. That we're going to go through on a live Zoom together. So that'll be interesting. So anyway, I'm going to share a screen with you. You may need pen, paper, lots of stuff to scribble on. You have your manual if you need to make more notes. Remember, the manual is there as a skeleton. It's there for a guide. But what I really want you to do is go beyond your manual to really, really understand the depth of all of this, including this one in particular, the section 5. So I'm going to share this, if I can. And I need to find system, which you can. Sorry, 2 seconds. You can see that. Off. Oh, here we go. Apologies for the language, by the way. Here we go. So, there's lesson A and there's lesson B. I actually think we can get through A and B in a one-er for this one. So, again, as a recap, just I need you to keep revisiting previous sections to make sure that you really understand it. I've said this before, that your learner achievement portfolio, some of the questions, again, they're not too difficult, so you can get most of the information out of your manual and just transfer it across into your learner achievement portfolio. However, your multiple choice exam, which is based on this unit 1, the full unit 1, is much more difficult. So make sure that you're not just skipping past joints and answering the questions and then putting it to bed. Make sure you do really understand joints, bones, now muscles, etc. going forward. Okay, so by the end of this lesson, you should be able to describe the characteristics of the different types of muscle tissue. You should be able to locate major, anterior, the front, posterior, the back, skeletal muscles. You should be able to identify and locate muscle attachments, so origin, insertion, and their actions, and explain the principles of muscular contractions. So, I know this is not an interactive way of delivering, it's pre-recorded, but I want you to consider your first thought about what is a muscle. Here, I'll give you a second. Tick tock, tick tock, tick tock, tick tock, tick tock, tick tock. So, I imagine most people's initial thoughts of what a muscle is, or what a muscle, what their considerations of a muscle are, is this diagram on the bottom right that you can see. So the muscles that we can see in the mirror, the muscles that produce movement often, and that's fine, but there is more than that. So we have 3 types of muscle tissue that you need to be aware of. We have smooth muscle, we have cardiac muscle, and we have skeletal muscle. So the smooth muscle in nature is exactly what it is. So it's smooth, it's non-striated. So when you're creating descriptions, you'll need to discuss stuff like non-striated. Non-striated is a posh word for it's not in these nice organized straight lines of muscle fibers that sit on top of each other and side by side. Non-striated. A good example of this is the digestive system. So small and large intestines, their function, so their job is to obviously contract and squeeze the food that we eat to try and break it down into smaller substances where we can start extracting the energy out of it. So that's your smooth muscle. Also, it's involuntary, so we don't have a voluntary choice of that muscle working or contracting. It just does it as part of our system. Also, we have the cardiac muscle. And the cardiac muscle is specific to our heart, or posh word, our myocardium. Again, non-striated, so it's quite smooth in nature. Also involuntary, so it's not organized by our central nervous system. Hopefully, it just beats. It just continues to beat, so the atriums contract. The purpose of the cardiac muscle is to contract generally oxygenated blood up and around the body to deliver oxygen to the working muscles, and also to deliver deoxygenated blood back to the lungs to pick up oxygen and then to come back and then travel around the body. That's the function of a cardiac muscle. Then we have our skeletal muscle. So the skeletal muscle is, I imagine, what most people consider when they think about what a muscle is. And the skeletal muscles are these things that are attached to our skeleton. And their main function is to provide movement. Okay, they are striated. So again, when you're providing descriptions, a skeletal muscle is striated in that it's organized into these nice uniformed lines of fibers, like we said, sit on top of each other and beside each other. And you can pick any muscle in the human body as an example. So here we've just written down hamstrings or triceps. Could be anything. This is voluntary. So it is organized by our central nervous system, which is our main computer base. And then it goes through what's called the somatic nervous system. Somatic meaning our body. So we have two strands. We have cognitive nervous system associated to our brain. Then we have somatic nervous system associated to our body. I've got my gloves on and I feel like I got sausage fingers. Oh, kind of got one step ahead of myself there. So smooth muscle, again controlled by the autonomic nervous system, not a conscious effort from us. Found in the digestive system, again processes and maintains body internal environment, breaking down foods, digestive tract. Cardiac muscle, found in the heart, main function is to pump blood around the body, oxygenated blood around the body, deoxygenated blood back to the lungs. It's involuntary, again, not under our conscious control. And the contraction of the heart is controlled by the sinoatrial node. And the sinoatrial node is an electrical switch, let's say, that sits within the heart, and it receives the information to say, contract, relax, contract, relax, contract, relax. And it organizes a rhythm within your heart. Skeletal muscle, as we said, is striated, so it has these organized lines. Attaches to the bones via the tendons. It is controlled by us, so the central nervous system, then follows through the somatic nervous system. It's a voluntary. And again, kind of like a lever system. So we have a muscle that contracts. It pulls on the tendon, which pulls on the bone, which creates movement. Resist the force of gravity to hold up body weight. Okay, so I think this is pretty early on. Yes, it is. Early on in your manual. So we have characteristics. So what our muscles need to do or need to have. So our muscles need to have elasticity. So they need to have the ability to lengthen, but also recoil once that movement or that need has stopped. We need it to go back to its original shape. Otherwise, we just fall over. Okay? We have no tensegrity. Is the posh word again? Tensegrity again, meaning that we have the ability to recoil and stay still. Contractility. I don't know if I've written that word right or not. Contractility, let's say. So again, the ability to contract. So we said it's a central nervous system thing, follows the somatic nervous system. So we have these signals that are sent out via the motor neurons to this via synapses to the motor neurons that sit within the muscles to say, right, you and you and you contract, please. then what we get is this muscular contraction creates movement or creates stability. And like I said, if we have elasticity, once that signal has disappeared, it goes back to the original shape and size. Muscles need to have extensibility, so they need to have the ability to be lengthened. And remember, muscles only contract, and muscles contract, right? And when they contract, they only contract short. And that's how our lever system works. So when we have extensibility, the muscles don't lengthen themselves. A muscle is lengthened via the opposing muscle shortening. So for example, if I want to contract my bicep, it originates from here, which is important to know, starts at your shoulder, ends towards your elbow. When it contracts, it pulls up towards my shoulder and pulls my radius ulnar with it, which creates a shortening or reduction of angle here. So a bicep curl or flexion at the elbow. As a consequence, the tricep is inhibited, so it's almost switched off, and the tricep therefore extends. The tricep gets longer as a consequence of your bicep getting shorter, because it's got this corner to go around now. Okay, so muscles have to have extensibility, the ability to lengthen. Sometimes as an inhibition to switch off, but other times as an eccentric contraction, which we'll get onto later, when the muscle gets longer under load. Okay, also it has to have electrical excitability. So none of this happens, so certainly not contraction. That doesn't happen unless we have the ability to send signals from the brain via the nerve system into the muscle. Okay, and we have these electrical stimuli that sit within the muscle. Make sense? So I waffled a little bit there, actually. So your four main characteristics of muscles are elasticity, so being able to stretch and recoil, contractibility, to have the ability to contract it into a shortened position, the extensibility, so being able to be lengthened, whether that be under load or inhibited, or to have electrical excitability. So to have these electrical stimuli sat within the muscles to organize contractions. And some of them tie together, as we now know. So again, like we said, you can't have contractions without having the electrical excitability. Okay, I'm going to slow down a little bit now. Felt like I was going really fast then. Okay, so you have two types of muscle fibers. Well, you have three really, but for now, let's say two. So we have fast twitch, and we have slow twitch. Type 1 is your slow twitch, and when we said we have two types, but two categories, but three types. And fast twitch is split into between type 2A and type 2B. Okay, type 2A, type 2B. And this is really important to know, because again, when we're working with athletes or just general populations, it's important to know or to have an educated guess about levels or proportions or ratios of fast twitch and slow twitch. Okay, so when we are describing the structure of slow twitch and fast twitch, or what they have the ability to do or not do, if we have a look on the left hand side of the table, so type 1, which is our slow twitch fibers, they are rich in blood supply, so in nature they are red. Okay, and because of that, they are now full of mitochondria. And mitochondria sits within these cells, and that's where we get our energy production within the mitochondria. That's where ATP, which we'll get onto, ATP is formed within the mitochondria. And within type 1 fibers, we have much more mitochondria, which means we have a lower force production. However, because there's lots of energy there, we have the ability to sustain activity, so we are more resilient to fatigue. This is, again, within the mitochondria, we need oxygen to help produce this form of energy. So it's an aerobic activity. And generally speaking, aerobic activities are ones that are of a lower intensity, but can be continued for longer periods of time. And we can only do that if we have the use of oxygen to help produce that energy. Make sense? So think marathons. So a marathon runner it wouldn't be silly to consider that a marathon runner would have more type 1 fibers than type 2 fibers. Okay? And that hence why a marathon runner can run over a long period of time, however, of a slower pace, because these type of fibers, they don't contract fast and they don't produce lots of force. However, when we look at type 2 fibers, so our fast twitch fibers, whether that be type A or type B, but if we go at more extremes to type B, they have less blood supply, which means less need for oxygen, which makes it an anaerobic activity. Anaerobic meaning no need for oxygen, or oxygen doesn't play a big part in energy production. Because there's a poor blood supply, it means that this tissue is generally white in color, blood making it red. So we have low levels of mitochondria in these types of fibers. Again, there's just no need for them to be there. So mitochondria, like we said, they sit within the cells and they produce energy via oxygen. However, they have the ability to produce high levels of force, but they fatigue quicker. So think sprinters. Sprinters have the ability to produce lots of downforce, lots of impact, which creates speed. However, you can't run that fast over long periods of time because the anaerobic system is less resilient to fatigue. It starts to burn out and we build up lactic acid. And lactic acid, again, inhibits production of movement. Just before I move on, just because, let's say like 50-50. Let's say we have 50% of our fibers are slow twitch, 50% are fast twitch. There is a train of thought and there is some science behind it to suggest that we can shift our proportions based on our training. So if we train specifically for speed, then we can steal some of our slow twitch fibers and transfer them into more fast twitch fibers. However, if you look at the literature, it appears that it's much easier to change fast twitch into slow twitch. Because generally speaking, over time and over age, we start to slow down as people. The dilemma or the argument still stands of nature-nurture. So nature, does that genetically happen over time anyway, that we just generally get slower because our production of fast twitch fibers are just changing into slow twitch. So even if we wanted to, we couldn't produce the forces to go faster. Or nurture, as we get older, are we just not training with intensity? Are we just not doing things quickly? Are we slowing down as a society or as people, which in turn would change our fast twitch fibers into slow twitch? I don't know, and I don't think many people know. But just know for now, these fast twitch and slow twitch fibers, we all have a combination of both. Some have a higher proportion of fast twitch than slow twitch. Some have a high proportion of slow twitch and fast twitch. But we all have a blend of both. And it is thought that we can change them or change proportions depending on our type of training. So we talked about this. Okay, so your job over the next 30 seconds to 60 seconds, get a pen and paper, and I want you to write down as many muscles, names of muscles, that you know or that you can remember. Doesn't matter how brief or how broad these terms are for now, just write them down. Go. I'm going to have a coffee. There are some muscles in there that really, like most people will know. You don't need to be a physio, you don't need to be a personal trainer. Who else do we have on the course? Massage therapists. You will all know some names of muscles. Lots of people go to the gym. We see it in media. We see it on the telly. And I hope you're not cheating, by the way. I haven't even looked at your manual. So within your manual, yeah, you do. So you have tables. Within the tables really good actually. Within the tables you have, are they sectioned off? So the tables are organized. Yeah, they are. They're organized into areas. So the first page I'm looking at is shoulder and arm. It starts at the neck, goes into shoulders, rotator cuffs, chest. It doesn't go into the arm. Oh, it does. And then it travels down into the arms, bicep, brachii, etc. So familiarize yourself with that table going forward. Whilst we're talking about the table, you really need to know the details of that, and you need to know it off by heart. So you'll need to know name of muscle, where it originates from, so bony landmarks, where it inserts into, and what does the muscle produce? What type of movement does it produce? Okay, let's see what you've got. So I imagine most of you will have biceps. I imagine most of you, well, a lot of you might have triceps. Biceps, front of the arm, triceps, posterior side of the arm. You might have abs or rectus abdominis is a posh word. You may have written calves as a global term for that group of muscles down the bottom. You may have written quads, again, as a family of muscles that sit on the front of our thigh. You may have written hamstrings, a family of muscles that sit on the back of our thigh. Glutes, again, part of a family that sit in our bum. I don't know how best you learn yet, but for me, I would say anatomy is my strongest point, I think, is my job. So for me, learning this sort of stuff, going through university, and still now, and that's not even a lie, still to this day, I go over anatomy because I hate the thought of not knowing it. So I will have pictures that I look at, and I just read the names. I used to write, so the tables you have in your manual, I used to make them tables over and over again. I used to write them down. I used to have areas, i.e. shoulders. I used to write down all the muscles that I could think of in the shoulders, where they come from, where they go to, what do they do. Over and over again. As boring as that sounds, that's the only way for me I would learn. Or at home, get sticky labels or get pegs. Pegs is often used. So when we actually get you into the clinic as a group post-COVID, then we will be. Pegs are a great one just to go and pin it in. Say, right, well, the bicep starts here and it ends here. And then I can say, well, actually, what is the bony landmark called? Okay, so this picture here, again, it's really brief, so it's quite misleading. The table in your manual is much more appropriate. So, for example, these are the anterior muscles. Whenever you see the word anterior, it just means the front. And when we're talking about the body, it's the front of the body. So you'll see that we have deltoids, top left-hand side, associated to the shoulder. But you need to know more than that. The deltoids come as a 3. Anterior, which you now know means the front. Posterior, which is a posh word for the back. And then medial. So we have a deltoid that sits in between the front and the back, sits on the side. And each one of them have their own jobs. And that's similar to, if you go top right of the picture, upper trapezius, that sits like bottom of your neck, top of your shoulder, that makes this link. But we also have mid trapezius and lower trapezius. I'd like you to know this sort of stuff. We have pec major, but you also need to know about pec minor. Within the shoulders, we have rotator cuffs. Again, many of you might have heard that term before. Some of you might be familiar with the muscles, but you need to know the 4 main rotator cuffs. Moving down, you've got your bicep brachii. Again, there are other terms in that area that you need to know. Internal external obliques, rectus abdominis. Yes, yes, yes. So quads, again, is a family of muscles. Hence the name. Fall, you need to know. Again, you need to know each one of them individually because they have different origin insertion. They have different origins. Adductors, so the muscles that kind of make up the inside of your thigh, they come as a family of 5. Again, you need to know each one of them. Tibialis anterior, you'll know. Iliopsoas, again, is a combination of 2 muscles together. You will need to know them 2, plus I think at least one more that make up that family of hip flexors. So the anterior muscles, I have this picture that you see, blank. So if any of you would like it, let me know and I'll send it to you. So then you can just label, check, see how well you did, bin it. Label, check, see how well you did, bin it. Label, check, and just keep printing these blank documents out until you've nailed it. But generally, the only way to learn this is repeat, 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 repeat. You can't learn this today or via this recorded session. It's just impossible. Because for some, these are all brand new words. For others, these are words that you're familiar with, but actually, I bet, and even for people like me, sometimes we forget origin insertions, or I do, I speak for myself. I forget specific origin insertions because we get lazy. We say, oh, well, I think the rec fem probably goes from there to there. I think so. But actually, I might be totally wrong. Not very often, mind. So, again, even if you know the names of these muscles, familiarize yourself again with in origin, where does it come from? Insertion, where does it go to? And therefore, what is the action? What does it produce? Rather than just thinking you know it, because when it comes to the exam time, you'll get caught out. Okay, posterior. So again, with reference to this, posterior meaning the back of our bodies. So this is, again, is not exhaustive. Latissimus dorsi is a big sheets of muscle that sit either side of our back. Essentially connects our arms to our ass. Gluteus maximus, our ass. Our hamstrings, so again, you need to be familiar with, we have 3 hamstrings on each leg. One on the outside of our, let's say outside, attaches to the outside of our shin, let's say, underneath our calf. And then we have 2 that sit medial, so 2 that sit on the inside. You need to know them. Gastrocnemius, so those of you who wrote down or thought calves, that's absolutely fine for now. But saying the calves are a global term for this family of muscles that sit below our knee on the back. So we have gastrocnemius, which is like teardrop shapes at the top of our calf. We have soleus, which makes up the bottom portion that sits underneath. Then we have another one there, but you don't need to know. Tricep brachii, so higher up. Hip abductors, again, hip abductor is not a muscle. It's a term used for a family of muscles. You need to make yourself familiar with them. Trapezius, again, the arrow is specifically pointing at the upper trapezius, but if you look kind of a little bit further down in between where the shoulder blades might sit, that would be where the medial trapezius would sit, and then a little bit lower down underneath the lats, you would have your lower traps. Rhomboids, again, term you need to be familiar with. They sit between the spine and the shoulder blades. Once you get used to these and positions, and definitely origin insertions, you can figure out, if you know origin insertions, you can figure out the movement it produces. Erector spinae, 2 nice, beautiful long muscles that sit either side of your spine. As we've said, origin insertions. So these are vital for you to learn. So the origin is the attachment point that remains relatively fixed during a muscular contraction. So this stays still. This is where the muscle comes from. Okay? Or I've got in brackets there, proximal. So whenever you see the word proximal, proximal means closest to the middle. So if we're talking about bicep, so a bicep travels from our shoulder to our elbow, because it pulls up towards the shoulder and pulls the arm with it, creating elbow flexion. So proximal bicep is closest to the middle of our whole body. Okay, so proximal bicep is further towards the shoulder, and distal bicep is further towards the insertions, further away. Okay, so whenever you see the terms proximal and distal, Proximal means closest to, distal means further away. So we have the origin, where does the muscle come from? And the insertion, where does it go and attach into? So distal. Again, I hope that makes sense. I hope I'm not going too fast. Again, this was produced with the thought that we were going to bring you in together. So rather than do the task now, rather than have pairs, going forward, it's a great task, actually, because, and this is why we always want to do theory, application, theory, application. So there's no point memorizing that table of muscle name, origin, insertion, action. There's no point memorizing it if you can't apply it. So whenever you come across the word palpate, so using the muscle tables in the course manual, palpate the origins insertions. Palpate meaning press or touch. So go through the manual and go through the table, and let's say like rectus femoris, so the muscle that sits in the middle of your quad from top to bottom. It's a nice thin one. It originates from what's called the ASIS, the anterior superior iliac spine, which is a bony bit of our pelvis. And then it inserts at our tibial tuberosities, which is a posh word for the top of your shin bone, just below where your kneecap sits. But it's important to go and put your hands on these places so you know what these bony landmarks feel like. And if you can tie up the two, like what the words say, and actually what does it feel like, then it makes things a bit more interesting. And it's, for me anyway, it's easier to remember if I actually think ASIS, right? ASIS is bony, like for me, bony, like sticks out quite a bit. But giving you a bigger picture to put it into context, the word to be able to palpate is really, really important because everybody is different. So you palpate yourself, you might palpate your missus or your husband or your kids or whatever it might be, and everybody feels different. So the structure of people's pelvis is very, very different between a male and a female. It's very different between an adolescent and a fully developed human being. And generally speaking, it's very different between person to person. And also, depending on our level of composition, so people who have higher fat levels and the ASIS is bony part of our pelvis is harder to find, then it just makes it a bit more difficult when you're working with people or on people, of expecting that this bony landmark is always in this particular position on everybody, because it's really, really not. So just get your head around the fact that palpation is really important. So you not only do you need to know the words, you need to know the words to pass your exam, your multiple choice exam. However, to make you a good practitioner, you need to be able to go and find it and work and feel your way around. Okay, hope that makes sense. So just to reiterate, memorize that table, really remember it, each word. There's a lot to remember. I appreciate that, which means chip away every day. Go and test yourself the best way that works for you. But also put your hands on these areas, so feel your way around, so you know again what it feels like. Go and find these tendons. Okay, top tip. Okay, so further on, let's talk about specifically the skeletal muscles. So you need to know, again, the basic structure of a skeletal muscle. So I think I've got, yeah, I do. Go back. Okay, so imagine the skeletal muscle like a big pack of straws, whereas there are straws within straws within straws. Let's start on the top right-hand side of this diagram, labeled the tendon. So you would have a bone. So muscles attached to bones via tendons. Again, remember that. Tendons, as you should know, are white in color. They've got a poor blood supply. They have real good contractile strength. They are robust tissue, and they have to be to absorb the forces that have been pulled on them via the muscles. Okay? Full of collagen. So we have bone, we have tendon that attaches into the bone, And then we have what's called the musculotendinous junction. And it's very difficult to point. If you kind of follow the tendon, the white material, and then there's a particular line, then we have red tissue. So this blend of white tissue into red tissue, we can term it as fascia. Or if you look at the epimysium, if you like peeled away, if you look closely at the epimysium, it's peeled off slightly and you can almost see through it. And again, that's suggested to be fascia. So fascia is this almost like cling film material that surrounds the muscles and surrounds specific individual muscle fibers within the muscle. If that makes sense. Like it surrounds the straw within the bag of straws. And again, the fascia again is a completely different topic of conversation. Really, really interesting for me. But we can discuss that later on. But the epimysium is the outer layer of a muscle fiber, skeletal muscle fiber, otherwise known as fascia. So then we have the muscle belly, which is again the bag of straws. Within that, so your bag of straws is made up by other individual straws. And each one of these are your fasciculi. Fasciculi? These words are horrendous to say. So we have these fascicles. So fasciculi is plural, but we have these fascicles, so these individual fascicles, which again are another straw within a straw. Okay? If you have a look closely, so we've talked about the can't say the word, epimysium, which is the outer layer. And then we've got these fascicles that sit within that. But if you look the bottom name, the perimysium. Perimysium is the white material, again, this connective material that sits within each fascicle. Okay? Then within each fascicle, we have the endomysium, which is similar to the epimysium. However, it's at a deeper level. It sits within. It's almost like having intermuscular, so around, and intramuscular within. So the epimysium is around, the endomysium is within, but similar sort of material. Then again, if we pull that other straw out, so if you pull the fascicles out, your fascicles are made up of, again, multiple muscle fibers, so individual muscle fibers. It's really hard to get your head around, but the easiest way for me is your bag of straws. You pull a big straw out, which is full of other straws. You pull that straw out, which is also full of other straws. It's like a Russian doll, isn't it? So you have a muscle fibers, and each muscle fiber, again, pull more straws out, is made up of multiple myofibrils. And your myofibrils are strands that are sitting within the muscle fibers. Okay? So you have, going over it again, bone, tendon, this white material, where the tendon blends into a muscle belly, so a big muscle, like quads or hamstrings. Excuse me. It's surrounded by this sheath, its outer layer called the epimysium. Hell, it's fire. Otherwise known as fascia. Okay, within the epimysium, you have fascicles, so individual groups of muscle fibers. And again, in between the fascicles, you have the perimysium. The perimysium, again, is like connective material that holds these together. If you pull out the fascicle, it's surrounded by endomysium, which is similar to the epimysium. However, the epimysium is the outer layer of the whole muscle group. The endomysium is the outer layer of individual muscles, as in the fascicles. Pull the fascicles out, you have individual muscle fibers, okay? Then that makes up each muscle fiber, we have myofibril. The reason that this is really important is, once we get to the myofibrils, it leads us onto the structure of the myofibril, which leads us on to how the muscles contract. And that's a sliding filament theory. So same, remind yourself, have a diagram like this, remind yourself of layers within layers, within layers, within layers. I know it sounds really complicated at the moment, it might look complicated, but they are just layers. So as long as you can get your head around, if I pull this bit out, what is this new layer called? If I pull this bit out, what is this new layer called? So think layers, and as long as you can get your head around that, you'll be absolutely fine. Okay, so the reason we talked about going from bone all the way to the myofibrils leads us on to, hopefully, the structure of a myofibril. So these myofibrils sit within the muscle fibers. And your myofibrils, imagine, imagine your straw, and then split your straw into 3s or 4s. And each one of these sections are what's called a sarcomere. So sarcomere is a section that makes up a myofibril. Within your sarcomere, so your sarcomeres are made up of two elements. So you have actin and myosin. So the actin sit on the outside of your sarcomeres. So again, imagine your straw, cut it up into sections, take one of your sections out. On the outside, on the ends, not the outside, on the ends of this section, you have these filaments called actin. Then what sits in the middle of this section is myosin. So remember these two. So you've got actin on the ends, either end, this end and this end. And then in between here, you've got your myosin filament. And this helps us understand this next term, so the sliding filament theory. And the sliding filament theory gives us the theory behind a muscular contraction. So how do muscles contract? Okay? So if we break down like bone, tendon, blah, 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 all the way to myofibrils. Myofibrils are now broken down again into sarcomeres, which sit end to end to make sections up. Within the sarcomeres, you've got actin on the ends and myosin sitting in the middle. So you can see here that the big red block in the middle is our myosin. Then you've got these little heads, these little red things that come out off it. And these are our myosin heads. And our myosin heads can become activated once we have ATP. So ATP, adenosine triphosphate, which is our fuel, so it produces energy. As soon as we have ATP delivered to this area, it engages or excites these myosin heads. So it makes these myosin heads just like a little bit more active, go on, and they're ready to start working. Okay? We also have blockers. So almost like we have police that just surround this area, and the police are there constantly unless they're moved on. Okay? As soon as we have ATP, which excites these myosin heads, then we have a release of calcium. And as soon as the myosin releases calcium, it almost just gives these policemen a nudge and say, "Oh, piss off. Go and get yourself a break. Go and have a donut." And what that does is it releases the blockers, it releases the policemen away from the area, which means we can get activity to happen. Okay? So ATP, so our energy source, is delivered into the myosin. That now signals the calcium release. Calcium release gets rid of the blockers, so the policemen are off duty now, they go and get a donut and they chill out. Okay? That now means that these myosin heads, they're excitable, they can start twisting and turning. And what happens is when they start twisting, they start to attract these actin filaments from the outside and start to attract them in, almost like gravity. But because they're twisting and turning, they're just kind of pulling them along, almost like a car wash. Hey, do you know what? This is the first time I've used that analogy, and I bloody love it. So imagine a car wash where your car is just kind of delivered in, and you get these spinny things that just kind of pull you through into the motion. So imagine that your myosin heads, so these little red things that are coming out of the red block, they're just kind of spinning the wheels and pulling the actin filaments in. Okay, so ATP is now in, calcium released, policemen on holiday, and then they start turning and twisting, they get hold of the actin filaments, and they pull in. So now the muscle is this size, whereas it was this size. So we've gone from long to contract, 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 contract. Okay? And then they release when the myosin starts to develop more ATP. So the ATP has been used up, we redevelop ATP, and now it has the ability to let go. So I hope that makes kind of sense. If I go to manual, because I think your question is about the 4 stages. So let's make it specific to what you need to know. Okay, so looking at your manual, so it has 4 stages. It has a cocking phase, a binding phase, a power stroke, and a resetting. Just to make things easier for you, let's talk in like the language of the manual. So the cocking phase, ATP is broken down, releasing energy to prime. So we talked about, if I go back, sorry. We talked about ATP being brought in, and that's your cocking phase. So it releases the energy to prime to get these myosin heads excited, okay? Stage 2, the binding phase. So the calcium ions we talked about in the myosin are now released, allowing the myosin head to attach. Okay, yeah, so the release, the purpose really of the calcium is to get rid of the blockers, to send the policeman away. And that's your binding phase. So as soon as the policemen are gone, so the blockers are gone, they can start attaching to the actin filaments. Stage 3, the power stroke, myosin heads rotate. So this is your car wash. Myosin heads rotate, and they pull the actin filaments in. So that's your power stroke. And the resetting, so stage 4, actin binds to myosin head. Yeah, so we have a more production of ATP in there. The myosin heads get hold of them, and that allows energy production to let go. Okay, so they're your 4 stages. When you need to know about that, for the sake of your question, that should help. Sorry. Okay, brings us nicely onto the all or none law. So I hear this all the time from lots of our patients, in that they talk about, I feel like my muscle isn't engaging, or it's not firing properly. It's firing a little bit, but not a lot. And I think what the assumption is that our muscle is controlled directly by a stimulus, like one stimulus, then the whole muscle contracts. Whereas sometimes the stimulus just isn't there, and it's only getting to this part, and it's just not true. So the all or none law suggests that the only signals, almost like binary coding, your signals are switch on or switch off, 1 or 0. That's it. There's no halves. There's no switch on a little bit for me, please, or switch on 75%. There's just not that. Remember, within skeletal muscles, we have receptors. So an impulse is sent down a neuron that all muscle fibers within that motor unit have. So we have a muscle here. You have sections within this muscle. Again, think about the skeletal muscle. So each fascicle, they have individual receptors that sit in and around there. Each receptor, if you get a signal, this one is on, this one is on, this one is on, this one is on, this one is off, this one is off. Okay, they're either on or off. No halfway, no in between. Sometimes, again, this is a big muscle. Sometimes you may not get these receptors may not get this signal, but these might. So it means that, again, if we go like 20%, 20%, 20, 20, 20, because I've got 5 fingers. Good maths by me, by the way. So this signal might not get it. So we have 80% function of the muscle. However, it doesn't mean that some of them aren't producing enough. They are all either, like I said, on, or this one might be off. So that's an all or none law, in that it's binary, in that you have full contraction or not contraction. Sorry, let me take that back. You have a signal to the motor unit to say on or not. Okay, but we have lots of motor units that help create a full muscular contraction or not. I feel like I've confused that a little bit, but we can chat about this anyway. Motor unit is either on or off. We talked about that. There's no partial stimulation. Blah, blah, blah. Okay, perfect. Explain muscle structure to partner 2. Done. Okay, quiz time. Okay, pen and paper out, please, cuz. What are 3 types of muscle tissue? Question 1. Okay, hopefully you said cardiac, smooth, skeletal. Hopefully. Question 2. What are the functions of each of the 3 types of muscle tissue? So the functions, not the characteristics. So function of smooth muscle. Again, remember your examples. Smooth muscle, the example we use is digestive system. So the function of this tissue is to contract, break down solids, so food, to help pull out nutrients. And again, the purpose of nutrients is to provide our body with microbes to either help fight disease or help growth and repair, whatever it might be. Function of cardiac muscle, nice and simple, is to contract, oxygenated blood around the body, deoxygenated blood back to the lungs to collect oxygen, come back to the heart, circulate blood around the body. The function of skeletal muscle, again, the act of like a lever system to produce movement. Question 3, what are the characteristics of each of the 3 muscle fibers? So think about structure that we talked about. So keywords for you to remember: striated or non-striated, voluntary or involuntary, or it's organized by the autonomic system or organized by the central nervous system via the somatic system. Which muscle fiber type is quicker to tire? So again, we have slow twitch, fast twitch. So type 1, type 2, A and B. Your slow twitch are your type 1s. Remember, your slow twitch are red. They are rich in blood supply. They are aerobic, so they are part of the Krebs cycle. So we need oxygen to help produce that. It's full of mitochondria. Remember, mitochondria is the powerhouse within the cell. That's where we have this energy production. It allows the production of energy over a long period of time, which means they do not tire quickly. However, the force production is low, so the intensity on the speed of the production is of a low level. So it's not that one. So the other side, so type 2 or fast twitch fibers, they tire quicker. However, they produce lots of force, which is why they tire quicker. They tire quicker again because they're anaerobic. We don't use oxygen. And the cycle that uses oxygen takes time to break down to create energy. Whereas the anaerobic system is a bang, 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 switches off. Okay? What are myosin and actin? So myosin and actin are these filaments that sit within sarcomeres, that sit within myofibrils, that sit within muscle fibers. Oh, that's a mouthful. And these filaments help to create the sliding filament theory, which helps us understand muscular contraction. What is the name of the tissue that surrounds the whole muscle? It's one that I couldn't say very well. Epimysium. Epimysium. Again, remember, bone, tendon, that blends into this muscular junction, and then you peel it back, you almost like you could see through the top layer, that epimysium. Question 7, what is the muscle at the front of the lower leg? You probably haven't gone into the muscles just yet. You're probably waiting for this ramble from me to be over. Tibialis anterior. What is the name of the muscle at the back of the upper arm? So I imagine it's suggested in this area. Lots of you probably will be familiar with this one, the tricep. Where would you locate the adductor muscles? So for this level, the adductors are associated to the inside of our thighs, make up our groin. There are 5 of them. So that's where you locate it, inside medial, inside thigh. Where would you locate the gluteus maximus? On your Gia, cuz. Okay. Right, let's move swiftly on into lesson B. I feel like we can do it. Muscles again. Right, so we're talking about different contractions in this lesson. Okay, let's go. So what's really important, so we're going to go back into skeletal muscles, okay? And we're going to talk about different types of contractions that produce movements, okay? So, types of contraction that you need to know. There are 4. I think I only talk about 3 in here. Right, so there is only 3 in the PowerPoint, but I'll add in another one. So you can see the top 2, so concentric and eccentric, so we have positive and negative. So in literature, so I forget what it says in your manual. It does in your manual. So the concentric and eccentric are under the umbrella of isotonic. So the word isotonic is making a suggestion that there is movement involved, okay? So isotonic makes a suggestion that the contraction involves some form of movement. Within isotonic, we have concentric and eccentric. Concentric meaning there's a shortening of the muscle under a contraction or under load. So here we give an example of a bicep curl. So within this example, the bicep curl, you would have to start at the bottom, and we're looking at the contraction of the bicep here. So as we bend our elbows, you can see my guns are wet. As we bend our elbows up, so remember the muscles move up towards the origin, away from the insertion. So the bicep will pull up towards the shoulder, it pulls our forearm with it, and it creates shortening of the bicep. Okay, so a concentric contraction is a shortening of the muscle through movement. The eccentric contraction is the exact opposite. So bicep curl still, so we've gone concentric to the top, and now when we're lowering, or we're on a negative phase of the movement, so lowering down, we're asking our bicep to lengthen as it goes from the top to the bottom. And it's that still a muscular contraction because it's still organizing the movement, it's still managing the movement. So the triceps don't push the weight down, we are controlling the weight down against gravity, which means the prime mover is still the bicep. Hope that makes sense? Then we have isometric. And isometric contractions make a suggestion that there is no movement. So the most obvious example that you'll often see in literature is a plank. So plank, you get into a position and you stay still, and we're asking lots of muscles to recruit to hold that position and stay still. So it's often associated to core exercises or lower back exercises, isn't it? So again, if we reframe this, we put this into a bit of context to give you a bit more value. When you're working with clients and patients, it's really, really, really important to know concentric, eccentric, isometric. Them 3 especially, because each one of them provide different benefits or different values through rehabilitation. So at this level, I'll tell you what, forget about me saying this level. So if somebody comes in with pain, we now know some more research looks at isometric contractions. So isometric meaning no movement. So isometric contractions, as long as they're done under an appropriate load for an appropriate amount of time, can provide lots of pain relief. So instead of taking paracetamols, non-steroid anti-inflammatories, some isometric contractions, especially with tendon-based injuries or tendon-based complaints, isometric contraction can provide anywhere between 4 hours and I think I read 10 hours of pain relief. So if you have somebody and they tell you, oh, listen, do you know what? I do have this sore knee as well, and they're telling you about some of their pains and problems, then an isometric contraction is a really good exercise to reintroduce the tendon or reintroduce a muscle to activity without it moving through ranges and having shortening, lengthening, because often when that happens, the movement's uncontrolled, the nervous system gets confused, or it just panics a little bit. But if we manage the movement and keep things still, Your central nervous system can down-regulate pain because it thinks, oh, I know I'm being used, I haven't moved yet, and I'm quite happy not moving. Right, that's good, I like it. So we start to reintegrate activity. So an isometric contraction is a really, really good way to start people off in terms of their rehab. Concentric and eccentric, again, hold different benefits and different values. An eccentric contraction now probably gives you more bang for your buck. So I don't often get people to stretch anymore because I don't see too much value in it. But an eccentric contraction can provide you with stretch and a strength element to it all at the same time. So you get a double whammy. And a concentric contraction, again, allows us to go through from long to short, which is a fairly safe way of training. Okay? So again, to give you a bit more value, a bit more context of why you're learning this stuff, then that's really, really important to give your clients best advice. So, if I open all of this, this will no doubt come out in your exam again. So roles of muscles. So muscles can play different roles within the same movement. So the example here is we're looking at, there's a couple more arrows to come. We're looking at a tricep extension. So the lady's bent over and she has an elbow here and she's probably about to do this. So I think she is about to do this. This tricep extension, this movement of the weight from the front to the back. So we talk about antagonistic pairs. And again, that's a really important phrase for you to remember. So antagonistic pairs are a pair of muscles where one of them takes over the movement and one of them allows the movement. So we have an agonist. So the agonist is the muscle that takes over the movement. So it's the prime mover. So in this exercise here, the tricep extension, the tricep is the agonist. It's the prime mover. It's the one muscle that's producing most of that movement. Okay? Then the antagonist is the opposing muscle. It's the muscle that does the exact opposite movement. However, it needs to be inhibited. It needs to switch off. So it's not fighting. It's not putting up a fight, trying to pull in the opposite direction. So here, tricep does the movement, and the opposing muscle to tricep, so tricep straightens your elbow, your bicep bends your elbow. So for this movement to happen, the bicep needs to switch off. It needs to not play any part in this movement. Because if it does, then it makes straightening my arm very difficult because my bicep's trying to bend my arm. Okay? So we have agonist and antagonist. Agonist takes over the movement. The antagonist lets the movement happen. It switches itself off. Then we have a synergist. And a synergist is a muscle that wants to help. It wants to assist in the movement. So here, the synergist can be a posterior deltoid. So it can kind of help pull the weight back behind us. Okay? And there might be multiple synergists. There might be a couple of muscles that are appropriate for us to identify that I actually think this one's helping the movement also. Then we have a fixator. And a fixator is a muscle that stabilizes a region. So it keeps things together to allow other joints to move around. So this example again, we have the elbow moving, and that's all we really want. We don't really want the shoulders to kind of move up and around as well, because it takes away the benefit of that movement. So a fixator in this example might be the upper trapezius to hold the shoulder in place so we can move through the elbow. Okay? So within movement or within an exercise, we have multiple roles going on. So we always have a prime mover. We always have a muscle that's taken over. If we have one muscle that's producing the movement, we have to have an antagonist. We have to have the opposing muscle that's switching itself off to let the movement happen. Always, it's very difficult to have one mover without the assistance of other stuff. So we will always have assistance, which is your synergist. And then if we want the movement to look good or be efficient, other stuff around that area that's moving has to stay still. Hence your fixator. So your fixator are a muscle or a group of muscles that help stabilize one area so another area can move around. Okay? And we are done. Wow, we're done. So you really need to get your head into your tables. So learn the names of the muscles. learn where they come from, the origin, learn where they attach into the insertion, learn the action. So what do they produce? And again, be creative, be consistent. So during the day, I don't want to take away from your day job or your family or other commitments. It's not what the course is there for. However, and the big however is, if you want to do well and you want to pass your exams, you're going to have to learn this shit. And for me, again, the only way for me to learn is chip away, chip away, chip away, chip away, chip away, test, 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 test. It's boring as shit, but that's the only way. Because for some, these are brand new words and these are brand new things to learn. For others, and maybe as more dangerous, for others who probably should know this stuff, please don't get complacent. Please don't think, oh, I know this inside out, because you probably don't. I don't know this stuff inside out. And I've been doing this job for 15 years. 15? Shit the bed, I'm old. Yeah, 15 years. So again, practice, test yourself, practice, test yourself. Get used to concentric, some types of muscular contractions. So what happens is, so try and tie the pieces together. So think, right, well, a concentric contraction of a bicep creates what type of movements? It creates flexion at the elbow. In and around this area, again, what might help? So a synergist might be forearms, so some of the muscles that sit within the forearms. A fixator, again, could be upper trap. It could be pec major to hold things in place, as long as you can justify it. So test, 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 test. Hope that makes sense, everybody. I'm going to unshare, stop the share. So we're going to be making calls anyway, individually, to check up on learning, to make sure that everybody is okay, everybody understands stuff. But you all have my number. There's our private Facebook group. Don't be shy about putting stuff in there to say, does anyone else in the group understand this? Does anyone else in the group have any tips, ideas, whatever it might be? I'm sure there are people in the group who are willing to help or who have found some good resources. Well, I know people have, because they've told me. They've found some good resources, they've ordered a decent book, they've found a good website, etc., etc. So ask each other. Remember, it's a weird way to deliver this course, because we're doing pre-recorded, we're doing online Zoom stuff, whereas ordinarily you'd be in the same room together, so you'd have your gear off, you'd have your clothes off, you'd be touching each other. So it's very, very personal, very interactive. We're just kind of lost that at the moment. So remember, you lot are still a group. So at some point, you're going to be in the same room together. So I suggest that it might be a good idea to get to know each other as soon as you can. So it's not too much of a shock when you do meet each other. So, well done so far, guys. Thank you for your time again. You have my number, you have my email address, so we have the personal Facebook group. I'm here, that's horrendous. I am here to help. Yeah, any questions, let me know. Well done, guys. Speak to you soon. Stop recording.